Hi, good morning friends. Today we are going to discuss about controlled drugs. In the previous video, we discussed about the narcotic drugs and narcotic preparation. And today we are going to discuss about the controlled drugs. Okay, now controlled drugs are listed in Part G of Food and Drug Regulation or Food and Drug Act. Now let's consider three parts one by one. Part 1 is CNS stimulants. The examples are amphetamine, dextroamphetamine, and methylphenidate. These drugs are normally used in ADHD, attention deficit hyperactivity disorder. Part 2 has barbiturates. Barbiturates are normally sleep-inducing agents, tranquilizers, sedatives, hypnotics, anesthetics, etc. So some examples are butorphanol and nalbuphine. And part 3 has anabolic steroids or androgens. Example is testosterone. So these three parts are really simple and we just need to straight memorize it, but it's really hard when in the exam there are we have so many information in our mind, like the narcotic preparation. So the controlled drugs are kindly getting mixed up with the narcotic or the narcotic preparations. But I have made one mnemonic to retrieve the specific part in the exam. So I have taken A from the amphetamines, B from barbiturates, and S from the steroid. So A, B, S, EPS. So if you remember EPS, you can retrieve all the parts, part 1, part 2, and part 3. A for amphetamines, B for barbiturates, and S for steroids. Okay, now these drugs are also kept under narcotic safe because these are highly regulated and has a high chance of theft overnight. And we will discuss about the refills and interval and all this stuff in the next slide. Okay, now this is the key part of the presentation and most important information for exam. So let's discuss the criteria as one by one. So the written RX and the verbal RX both are fine for all the parts. Refill is allowed, but the interval must be mentioned on the prescription. So interval is the time period patient need to wait to get the refill. So if we are, for example, we are giving 90 pills to the patient and the interval is for 90 days, then patient cannot have the refill until 90 days are completed. So if, for example, the patient is getting the medication today for 90 days supply and the patient is coming early after 2 months, like 60 days, and ask for the refill, we cannot give refill to the patient because patient must wait for the interval like 90 days to get the refill. Now let's talk about the transfers. Transfers are not allowed for any of the parts. Purchase record is required. Purchase record is nothing but the invoice copy which is kept for a particular time and which is stored in the binder. And sales record is required only in part 1, not for part 2 and part 3. So this is the very important examination oriented information about controlled drugs. You can Google it for the brand names, but brand names are not really important for the exam because they are giving the generic name on the side. So we don't need to worry that much about the brand names for exam.